Welcome back to the Girl Doc Survival Guide. Today I'm very pleased to be with, and I will say his full name once, Dr. Antonio Subtil Jolivera, but I call him Tony Subtil, Dr. Tony Subtil, who is currently a clinical associate professor of pathology and laboratory medicine at the University of British Columbia, as well as an anatomic pathologist at the Royal Jubilee Hospital. Dr. Subtil is trained in both hematopathology as well as dermatopathology. He has a special interest in cutaneous lymphomas and has given hundreds of invited lectures at regional, national, and international meetings. I know Tony because we worked together at Yale, and he was my neighbor. The office right next to mine was Tony's, and so it's always fun to show him cases and sometimes just chat about random things and admire his fashion. It's fun to talk to Tony again.
Hi, Christine. Thanks for having me. I miss you.
I miss you too. Can you share a personal anecdote first?
Sure. I was a teenager when I was accepted to medical school, 16 years old. I'm from Brazil originally, and down there, you start med school right after high school. I was really young. I didn't think I was too young to be in med school, but looking back, I can see that I was a bit too soon to start that. I'm actually going to my 30-year med school reunion this year. It's hard to believe because I still feel young, but it's hard to believe that I've been a doctor for 3 decades. My dad passed away when I was in the last year of medical school, and my mom passed away recently. So I was thinking about how these 3 decades have been bracketed by losing both parents, something that has been on my mind lately.
Yes, I'm sorry to hear that. You had told me about your mother passing and how grief has been really hard. We talked just by text really about it would be great to talk about grief together and what you've learned.
Yeah, to me, it's interesting because before experiencing grief myself, I had some assumptions about it. And I think for physicians, it's often shocking when we go through grief personally, because in training, in practice, there's just so much death or severe disease that we witness. And it feels sad. We don't want that happening to our patients. But it's the reality of medical practice to just have death and severe disease happening. So we might have this assumption that we understand grief because we are witnessing grief in our patients. But going through grief personally, that's completely different. That's a completely different experience. It feels different. Before experiencing grief personally myself, I had this assumption that emotionally it would feel like falling off a cliff. A sudden drop, and then slowly you get back up from that valley. But for me, after losing my parents, it felt more like an EKG tracing, ups and downs, more downs than ups actually. Or it was irregular, random, more AFib, or it felt like VTAC at times. To me, that was a surprise, that it wasn't just like this deep sadness, but it was more, the whole range of emotions could happen in a day. Sadness, laughter, and joy, I definitely felt different going through that personally. Another surprise for me is that I thought of grief as about big things, death, divorce, but I think grief is about any change, any loss. So even smaller losses, they can induce a level of grief that we might not acknowledge, whether it's a health problem in yourself or a close family member, even moving. Aging has its own grief, retirement can produce grief in some people. So it's not just big things like death and divorce that can cause grief. Any significant loss can do that. So for me personally, I moved a lot doing training. Med school in Brazil, my internship in Miami, residency in Missouri, fellowship in Minnesota, another fellowship in Atlanta, first job in Connecticut, and now in Canada. All these changes, all these new chapters can feel exciting, but there's a cost to them. And we often don't think about the cost of moving to friendships, relationships. We're always looking forward, what's next. But I think we have to acknowledge the impact those smaller losses. And they can actually be a good training ground for the big losses. As physicians, we like to think of skills as a good thing. We could think of grief as a skill. Grieving well can be a skill that you can learn. If you can acknowledge smaller losses, those smaller changes, and process them and adjust to them, when big events happen, you're going to be better prepared to go through that grief process.
I like how you said that. Grief as a skill to develop how to deal with it well is something that we can work on and improve ourselves in doing. What do you think are the components to that skill?
Yeah, we learn in school the 5 stages of grief. For me, in terms of timeline and different stages, I didn't really feel that. For me, the paradigm wasn't very helpful. Stages that, I'm supposed to be bargaining now or whatever in real life. And I think each person is different too, and they're going to grieve differently as well. But they were designed or described for patients who are dying. They weren't meant for the people who lost the loved one. So those 5 stages of grief are actually more about that person as opposed to family members. But one paradigm that I like is accept, process, adjust. First, you have to accept the reality of the loss, of the change. You have to overcome the initial shock. The processing part is the one that most people struggle with because it's natural for some people to ignore the grief, ignore the pain. You want to avoid it. You want to push it down. But I think we do have to process all those feelings that keep coming up. It will be different feelings at different times. It won't be just sadness. I think anger often shows up as well. We definitely have to feel them going through that process. In isolation makes it even harder. So I think talking to someone, have some community in your grieving process that can be very healing. And it can look different ways. It could be a friend who has lost someone as well. It could be a therapist who has experience with grief patients. Some religious organizations have small groups for people who are grieving. And I think that can be very healing as well. Just knowing that you're not alone. Grief touches everybody. Different types of grief are just a human experience. Remember that you're not alone. Don't isolate yourself.
So you said accept, process, and what was the third thing?
The third thing is, thanks for reminding me, you kind of have to adjust to this new chapter, to this new world, these new circumstances. I like the idea of thinking of like a book with chapters, like life can be seen that way. There are different chapters. Things are always changing, right? We forget the impermanence of life. We know change will happen, but we hold on so tightly to everything that when any change happens, we have such a strong response and shock. In your book, the book of your own life, you don't want to be stuck in a chapter, right? We are going to get older, health problems happen, we're going to lose loved ones. This chapter, this terrible thing happens, you lose someone or you get divorced. Life goes on. You don't want to just be stuck reading that same chapter over and over. But you do want to acknowledge the ending of the chapter. And I think, again, accepting, processing, and adjusting can help with that. Gratitude can be very helpful to close that chapter. I'm grateful for the good times we had before the loss happened. And I think for the new chapter, I think trying new things can be very helpful. So maybe try to add a sense of adventure to your life in this new reality. Is there something new I can try? I think it can be healing as well in terms of moving forward and not getting stuck.
Are you doing something new?
This year, I started working with pottery, like ceramics. It has been fascinating with the clay wheel and creating a piece of pottery from mud, basically, and painting this piece that you yourself created. Yeah, I've made a bunch already. That has been fun, something low-key, just for fun. It felt very childlike, like you're playing with mud, basically.
That's cool. Pottery, neat. You mentioned the 5 stages of grief. Those are denial, anger, bargaining, depression, and then acceptance. But you're right, they really based it on someone who gets a terminal diagnosis and they move through it. So it's probably a little different for us when we're dealing with something that's happened to us. But yeah, the last stage is acceptance. So it ties in with what you were saying, accept, process, and then adjust. I like how you put that because it ties in too with what you said first, that as doctors, we're used to death. We're familiar with it. So we accept it, but whether we really process it, even when it happens to us in training, I don't think we even fully process, at least I should say, when I was in training and some of the patients in my care did pass away when I was an intern. Some of them were very sick. They would pass and our workload was still really heavy. There was never a time to mourn the patient, not at work anyway. People talked about this during COVID, that just droves of people passing away in the hospital, and there was never time to grieve them as healthcare workers. So, yes, I like how you put it. We not only need to accept something terrible happening, but process it in our way and then adjust. Yeah, that's wise.
It's good practice to just process any change, no matter how small it is. I think that's good preparation for when the big stuff happens.
How do you process it? I don't even just necessarily mean you. I'm just thinking, how do I process things? For me, I have to sit with my emotions. A concrete example is if I feel like crying, I will cry. Not right away. I try not to cry in public, but when there's a safe, appropriate space for me, I will cry over things for sure.
Yeah. I think that probably is going to look different for different people. For me, journaling has been very helpful. Acknowledge what happened, go through the feelings, definitely feel the feelings. Don't block them, don't ignore them, don't avoid it. Exercise can be a good way to physically express emotions that might be deep inside. Sometimes at the gym, I would see an older woman that resembled my mom, and I would get emotional in the gym. So it's tough because I'm going to the gym to let it out, but physically, I don't want to be crying in the gym. Another thing, therapy can be very valuable in helping you process things and move forward. It's important to pay attention to the other relationships in your life. Let's say if you lost a close one, the other people in your life want to help, but they're not sure how. Paying attention to the people that you're close to and telling them what you need. That might look differently at different times. Patience and time, right? It's hard, but it definitely gets better, especially if you process it and keep moving. I don't know if there's an easy recipe, but I think you don't want to get stuck.
Yeah. You said it feels like an EKG wave, ups and downs, and maybe more downs, especially in the beginning. But does it get better?
Oh, yeah, for sure. Yeah, it definitely does. But it does take time. But I think not having expectations on yourself, it has to be 6 months. It has to be within 12 months. So maybe not worry so much as the timeline, but just be kind to yourself as you go through the process. You might have to pull back at times during that process. Something that has been helpful to me as well is learning how to say no. And especially in academia, we are often expected to say yes to everything, right? If you have an invitation, yes, the answer is always yes. And that can be a recipe for burnout. So I think there might be times when you're grieving that you do have to decline certain invitations, some certain requests. People are going to totally understand. I heard the other day of the word no, meaning the initials NO, as new opportunity. So no equals new opportunity. Especially when you're grieving, saying no means saying yes to yourself and creating space for new opportunities.
I love that. New opportunity is NO, no. That segues nicely into something else. Do you have tips on how to still thrive in a career, whether it's academic or otherwise, when you do have grief and you need to accept, process, adjust, and sit with the grief?
Self-compassion can be very important. I think that kindness, we're often told to be kind, like show kindness externally to other people. But I think learning how to show kindness to yourself internally can be more challenging than showing kindness externally.
I like that. Do you have any final thoughts?
My final thought would be that grief is the price you pay for love and connection. I read that quote somewhere and I thought that was a good way to describe grief. And Martin Prechtel defined grief as praise. Let me read that here. Grief is praise because grief is the natural way that love honors what it misses. Grief is praise because grief is the natural way that love honors what it misses. I agree with that. It's hard, but it's worth it. That's the price you pay for the love, for the connection. If you're grieving, it's difficult, but it's a good sign. It means that there is connection, that there is love in your life, that now the grieving process is honoring. So I hope that we can all lead lives worthy of that grief.
Yes, that's a good way to end. Live a life worthy of grief.
It's worth it.
Thank you, Tony.
Thanks for having me. I miss you.
I miss you too.